out, but to my bottom left, I see Fred Camillo, who is, of course, our first selectman. And thank you so much for being here, Fred. We have, to my right, we have Harry Aurora. We have my neighbor, Steve Meskers, and Kim Fiorello. They're all our wonderful state representatives who enjoy schlepping up to Hartford often. And of course, we are sorry that Alex Kasser couldn't make it. She had a scheduling conflict and let us know the other day. So that's unfortunate, but we hope everything's okay for her. So let's get started, shall we? This question is to Kim, Harry, and Steve. What bills are you personally initiating and drafting for legislation in the next 4 months?
Is there a specific order you want us to follow, either by?
Since you're talking first, we'll start with you, Harry.
Yeah, no, it's funny because the natural order is 149, 150, 151. So I've gotten used to it. But thank you very much. I'm happy to speak first. Thank you for organizing this. It's such a pleasure to be here with all of you. And I really appreciate what United Way does for our community. And Greenwich is really very fortunate in having such a strong set of nonprofits, which work actually very closely, which work together in solving some of helping the government as well as our community solve public issues, public problems, and provide public goods. We are so incredibly proud of you and of all other nonprofits in town. Now, to address the specific question, really, let's just, we are in a crisis. I'm not going to say anything other than the fact that the first thing is to contain COVID. No COVID containment, no policy relevance. I think, obviously, at this point, because of the state of emergency being declared, the legislative role is somewhat different. We are not specifically in specific setting policy, even with regard to the spending or other things. But nevertheless, our input is still equally important, whether it's as advice or whether it is as raising awareness. And this is a much difficult problem. And vaccine is coming, but 3-4 weeks ago, when anybody who had a fair look at the numbers could see that the mortality was going to go from 10 to 50 a day, which we are, maybe 40 a day averaging in the last 10 days. And the vaccine, when you look at the numbers here, which have been given, do not look that they're going to come too fast enough. So we really have to address the first, second, and third challenge right now is going to be make sure that our mortality from COVID is contained.
Thank you. Steve?
Yeah. So I'm going to attack it from a different point of view, but I'll finish up. I think Harry's got it's an on-mark observation. It's a very interesting issue. The problem with COVID, it's got a revenue and business and industry aspect to it for the state's balance sheet, which is very significant. But the first and primary issue, obviously, is health and safety of the population. So controlling the virus is very important. I think the interesting issue, or the frightening issue, or the concerning issue, is going to be a slightly different issue than we faced in the first go-round, which was a combination of capacity in our intensive care units. And this time it's going to be a combination of my concern about capacity as the virus continues to spread. And it's going to be a manpower issue, because last time around, as the virus spread and peaked in many places, it wasn't universally across the country. So there was workforce accessibility for our intensive care units and for our hospitals. So I'm concerned there. So I think that's a worry that we're going to have to be monitoring and dealing with. Going forward on the business side, I think there's a couple of things I'd like to see us do. The first, which is kind of an odd issue, is transparency and potentially regulation of some of the new applications, Uber Eats. Okay. Uber Eats, et cetera, who are charging our restaurants about 30% for their fees. So I'm concerned about business development and sustaining our restaurant industry and the service workers there. So I'm looking to do something there. I'm going to be working on the insurance industry as well. There are issues I'll bring forward
gonna-
afterwards. That's it. Sorry.
Thank you. Thank you, Kim.
Okay, well, good morning, everyone. Thank you so much for this nice morning way to spend some time together. I have been appointed to the Judiciary Committee, the Planning and Development Committee, and Finance. And I know I'm filling big shoes in succeeding Livy, but I hope to do as good a job as Livy has done. On the Judiciary Committee, I would like to keep an eye on public safety, and I have continued to have conversations with those in law enforcement. I intend to craft a bill that responds to the needs of our police officers to ensure and continue to ensure public safety. In planning and development, we have not so much that I'll be submitting bills, but I will make sure that our Greenwich and Stamford community are very well aware of different legislation that's coming forward. There may be something related to state control over local zoning, and you can be sure that I will let you guys know where that stands. And on finance, I will keep reporting back to you on the state of our state's finances and ensure that we are not increasing spending and that we do everything to decrease our taxes. If we want to grow our economy in this very difficult time, it doesn't come from raising taxes on the people who are already financially, emotionally, psychologically strained. So those are what I'll be keeping an eye on the committees I'm serving on.
Perfect. And exactly 90 seconds, Kim. Good job. Our next question is actually for all of you. And of course, I'll defer to Fred first. What is your first action item to increase the state of Connecticut or town of Greenwich revenue? And what is your first action item to decrease costs in our town or state, given that this current COVID-19 pandemic comes at a very significant financial and social cost?
Thank you, Joey. Good morning to you. Good morning, David, United Way, and my colleagues and guests. It's great to be here. I'll be better next year in person again, but we'll make do now. And this is certainly a good forum, and we have seems like we have a lot of people here, so that's good. First and foremost, especially during this pandemic, don't cause any more harm. Meaning, don't increase the cost of living for our residents. Last year, when we got sworn in, we were hit with something right off the bat, something that the state legislature did a few years ago with increasing the sales taxes, and that hit something like parking services. So right off the bat, we were in a deficit, and we had to fix that. So hopefully, we won't have to do that again this year. We are crafting a budget now, so I don't want to pinpoint any things because it's moving right now, so we may have to adjust it. So that, and also how to increase revenue. I think you increase revenue by making the town more attractive. It's always been a destination. We're trying to make it even more of a destination. Whether it's parks, buildings, or the streetscape, we've already started to do that. If you make it a more appealing place, people will come, and we're seeing that now. So certainly, those are things that are on the forefront. We'll continue to do. But again, first and foremost, we don't want to do any more harm. People are hurting, and this will be felt for quite a while. So as Harry mentioned, with the vaccine coming and things looking good months down the road, we still have a few tough months ahead of us.
Thank you. Thank you, Fred. Kim, do you want to go next?
The question is, what will be your first actions to increase state of Connecticut revenue, or your first actions to decrease the costs in the state of Connecticut? To be honest, I feel like right now there's so much that's in flux. I think a lot of it is not passing any massive legislation, but do everything we can to support those on the front line and support our local businesses. To that end, the Republican caucus has asked that the minimum wage be delayed, the minimum wage increases, or the paid family leave increase, which will hit businesses on January 1st. We are looking to do what we can to relieve some of the pressure on our local businesses, but I'm not sure what major moves we can make to boost revenue. We just need to have a steady hand, is how I feel right now.
Thank you very much. Steve?
Yeah, so we're walking into the pandemic with about a $3.1 billion rainy day fund, which is about 15% of the operating budget of the state. It's probably the healthiest of the rainy day funds of almost any of the contiguous 48 states in the US as a percentage of the operating revenue. Obviously, it's a small state of 3.1 million people versus 65 million in California, 38 million or so in New York. But so the rainy day fund leaves us in a fairly decent position in the short term. So the crisis or on revenue side is not necessarily there. I think the spending side, what we have to look at is how do we manage a budget, which looks going forward to have an operating budgetary deficit of about, I think this year we're expecting ceteris paribus about 900 million, the following year 2 billion. So the rainy day fund gets exhausted if we run at the same spending rate within 2 years' time frame. So the real question is, what's the kind of adjustments of $500 to $1 billion in expenditures can we reduce over the next couple of years to make the budget fit? On the countervailing issue of what we're going to do, whether drastically or not, is we don't know what level of federal aid, we don't know what level of recuperation we're going to see from the local economy. And given where we are fiscally versus New York and Massachusetts, I think opportunistically we might see tax rates going up potentially in New York and Massachusetts, and Connecticut becoming more attractive. So I think we're in flux still.
Thank you. Harry?
Yes, so the first thing is we agree that we cannot tax more at this time. That's just not on. So as Kimberly suggested, we have proposed a 3-month delay of the starting of the taxation, new taxation from the paid family leave. This paid family leave tax is primarily an ordinary person's tax, or ordinary hardworking person's tax, because it really does not hit billionaires and millionaires, because they're not gonna, they have especially the self-employed, they get to opt out. It is basically the minimum wage guy who gets hit with it. So we are asking for the hardworking Americans who are under, many of them don't have a job right now, or have lost one job in the family, to delay that by 90 days. It won't affect the fiscal standing of the program, because the program only starts paying 12 months from now. It does not need any money right now. It's just a rush to collect money from the hardworking people, which we do not like. Remember that we did not delay the wage increases for the state employees. We did not delay those. So I think it's appropriate that we do not impose new taxes at this point on the hardworking people of Connecticut. So that's extremely important. We need more transparency on the $1.3 billion which came in from the CARES Act. $1.3 billion came in. We have no idea. We have put in on the side as legislators, we need more transparency on that.
Thank you so much. As many of you or all of you know, ALICE stands for Asset Limited Income Constrained Employed. The 2020 Connecticut United Way's ALICE report revealed that 38% of households in our state and 29% in Greenwich have income which falls below and what is needed to pay for basic necessities like housing, food, shelter, healthcare, childcare, technology, and transportation. What initiatives are you working on or plan to work on to support low-income families? We'll start with Fred.
Thanks, Joe. Appreciate the question. So we're going to continue to partner with organizations like the Housing Authority, which I'll get into with a later question, some of their activities and how we're working with them. Neighbor to Neighbor, which we worked with and did a partnership to allow them to go over to where the teen center is, and during this pandemic, which has been very, very helpful and very successful. And we're looking at a backup facility just in case that didn't work out. But right now, it's still going on. We appreciate the work they do, and organizations like the United Way. When the pandemic hit, first thing in March, spoke with Dave Rabin, and we realized that people were getting laid off, and in some cases, the children that were in school, the meals that they were counting on during the day were not going to be there, and we had to act quick. So we reached out to the BET in an emergency. This was actually even before any Zoom opportunities. We were just talking about Zoom in the middle of March, and we didn't have our first test run until like a week later. So we funded seed money, $100,000 of the town to the United Way for their effort, and then they raised a lot more, which I think was real money well spent and the right thing to do. And we'll continue to do things like that, but more importantly, to try and stay ahead of these things. And the United Way and David are constantly reaching out and telling us what they see in the forecast, what's coming down the road, and we try our best to stay ahead of it, so we're not reacting always.
Thank you, Fred. Harry, why don't you go next?
Thank you. And I really thank the United Way for taking leadership earlier in the year, as Fred mentioned. I think that was a real crisis, which all of you and all of us worked together to avert and to really provide the necessary resources for addressing very important issues, hunger and food security, and so on and so forth. Now, going forward, listen, we have to be really take leadership on this. And there's federal government programs which have been extended. Actually, as we all know, the SNAP program has been supplemented, which is really good thing. And in addition, and the state actually, which administers the SNAP program, which is federal money, has been fast in actually acting on that, which is really good. The unemployment program, which obviously had its hiccups in the beginning, is now working well. It's also for self-employed. In the summer, it was really working nicely because with the federal supplement, it was ending up being $1,250 a week. So for most families, it was reasonable amount of replacement when they lost a job. At this point, with the current discussions, we might get back to a maximum. Let me say the maximum of $1,250 a week, $650 maximum from the state government, and $600 from the federal government. So right now, those are the primary tools, and there are many other pockets which we are looking at, and we'll continue to make sure that there is more support for families which need help. And make sure that it reaches the right people.
Thank you, Steve.
So early on in the crisis, I worked very closely with Neighbor to Neighbor to resolve some of the issues. Not so much at the local level, because I think the level of support they got from Fred and from the town generically was very good. But the food security issue I got involved with early on, and into the administration and into the administration of the Connecticut Food Bank and food shares. In fact, this week, there's an announcement, or it came out yesterday, of a merger between the Connecticut Food Bank and Food Share. So I think one of the issues now is that we're going to create a network in the private sector, nonprofits, of food distribution for the security, food security for the state, which should be instrumental. Along those lines, I've worked as well to establish better purchasing procedures at the food bank, along with the pantries, to try to coordinate the use of private sector funds.
Thank you very much, Kim.
I think it's hard to know that there's 29% of us in Greenwich who are struggling for basic needs, but this totally speaks to the fact that it's this wonderful civil society with organizations like United Way and Neighbor to Neighbor that shows you it's not big government programs that help our neighbors and we help each other. It's actually the neighbors and individual initiatives that really make a difference in each other's lives, that really shows where we innovate, we overcome, we adapt, and we continue to love each other. In terms of a specific initiative I think all that we do to boost the economy helps all people who live in Connecticut and low-income families. But specifically, I would love to have a chance to push forward an opportunity for individuals and businesses to make tax-free donations to tuition for low-income students and special ed students. This would not take away from public school funding, but it would create an incentive for support of special need families and their costs, and low-income families and their costs in education.
Thank you very much. We're going to move to the topic of seniors in our state. So I'll ask our state reps the following. Like many states, Connecticut is confronting a growing elderly population, high nursing home and Medicaid costs, and an increasing desire among seniors to remain in their own homes while receiving care, for example, aging in place. What proposals are you working on or plan to work on to support and help the seniors age in place? And we'll start with Steve.
Well, I think the issue of aging in place, the issue of creating a safe environment is key and fundamental to quality of life. We see it in the town, we see it in the figures. I think what you see when you talk to the administration of Nathaniel Witherall is that the nursing home is becoming more the final transition place when the healthcare issues overwhelm the individual and the family. And the nursing home becomes the final and last residence point at the end of a crisis. So far, Connecticut has been fairly aggressive in the funding and support of initiatives to allow people to age in place and stay home. You know, in Greenwich, as Kim mentioned, on the private sector, we see a number of initiatives here to provide daycare during the day for adults with disability issues at River House, et cetera. We see TAG involved in the transportation, making it more accessible. I think the initiatives have to be more at the municipal level, and some of those practices that have to be brought up to the state to try to make it more affordable and accessible. And I think the learning process is a place like Greenwich, who's got all that opportunity space and the knowledge between the nonprofits and the town to bring those practices up to the state and institute them.
Thank you. Thank you. Kimberly.
I can only say that I have a very soft spot for the elderly. I took care of my grandmother. She lived with me till the end of her life. And I know that it's very hard to take care of the elderly. I have not looked into any legislative initiative to support this sector, but if anyone has any ideas, then please call me. My phone number is 917-940-4714. And I'm very open to listening and doing anything I can to help anyone who has an idea for easing the lives of the elderly, who we have great, tremendous respect. I mean, they are treasures.
Thank you very much. And I hope you don't regret giving out your cell phone number. Harry.
Yeah, no, I think this is a very important issue, and we have a number of initiatives we got to work on. You know, I want to, however, steer our conversation really towards the crisis which is hitting the seniors the most. You know, as you see and I normally take the 60 to 70, which number which the government provides, the state government provides as the bellwether. And both in terms of mortality as well as infections, that's not looking good. It's really not looking good. And I think at this point, we cannot act as if things are normal. We really cannot. And that's really what's wrong here. What I had proposed to the governor's office, since they're making all the decisions.
We're about at time, just so if you could finish.
Yeah, no, I think I hope I can borrow time from the next question here. This is extremely important. we had proposed to the governor's office that, listen, what we got to do is some kind of a aggressive once a week testing program for a large number of constituents, because Deborah Birx had pointed as well.
Harry, I recognize the importance of this topic. However, if
I'll continue next time around. But
okay.
I think it's very important.
I just don't want you to lose out on the entire answer time.
Sure. So it's very important to help our seniors fight this crisis at this time. It's existential from that. We can talk about other long-term things, but if we don't help them today, we are not helping them.
Thank you. Okay. And Fred, do you want to speak from a town perspective?
Sure, Joey. The 65 and over demographic is one of the fastest growing, if not the fastest growing in the area. Working with our Commission on Aging, which does a great job here in town, they have gotten things put into the POCD here in town that will help people age in place. And I think it was in 2019, we became a dementia-friendly town. We were the first to become an age-friendly town in Connecticut, and we're trying to become one of the few in, I believe, the country that would be both an age and dementia-friendly town. So we're definitely working on lots of things in the town level, and that's really all credit goes to the Commission on Aging.
Thank you very much. And of course, we're very lucky to have that commission here. We're going to bridge over to healthcare, somewhat related. And many of you mentioned this. So the question is, rising healthcare costs continue to be a concern. What are you working on or plan to work on to address rising healthcare costs, prescription drug availability, affordability, and healthcare policies? So I'll start with Harry, negative 25 seconds.
So listen, I wanted to say that, from a senior's perspective as well, it's very important that we have a strong healthcare solution really to the current crisis. One of that being extensive testing, which we have proposed. And it can, Dr. Deborah Birx had pointed out that if colleges with tested once a week had 1% rate, while college with tests the way we are testing right now in the communities had a 15% rate. So we have to be evidence-based. Now to quickly talk about public about the healthcare cost, we are going to be discussing some kind of a public option. It appears to be, from the agenda setters. And I'm looking forward to it because we have some great solutions we want to propose. And I think in the debate, those will come out, and we will have that opportunity because we don't get that opportunity in the State House to do that. But I'm looking forward to proposing some strong ideas to reduce healthcare costs.
Thank you so much. Steve?
Yeah. In the last session, or even I guess in the session prior to Harry's election, and then subsequent in Harry's election, one of the comments he made and one of the comments I'd made prior to that was related to pharmaceutical costs, drug care. You will find the United States has built a system where we are the single largest payer of the development of medicines in the retail price of all of our pharmaceuticals. We pay 3, 4, 5, 10 times what they pay in the OECD countries. So when you talk about a public option versus a private option, the first issue you want to deal with is the costing structure of healthcare. So one of the issues that we had mentioned and we tried to move forward was to get FDA approval to import drugs from Canada. I think we have to look to see what we can do to reduce the costs of healthcare or to share the burden with the rest of the developed world for the research costs, where right now the United States is bearing all of the costs at the retail level, which is why you can get cheaper drugs in Canada than you can get in the US, which makes no sense to me. So I think competitive pricing, stripping out some of the costs or making the world pay some of those research costs is part of that plan.
Thank you. And Kimberly, would you like to?
Yes, I'll add that what will drive prices down is a level and transparent playing field for those in the healthcare industry. And to that end, there's a lot that we can do. One of the things that I would love to do is suspend or get rid of the certificate of need that really limits the work of our hospitals. And I've spoken to a few doctors who feel very strongly that Connecticut does not benefit from having a certificate of need, which really hampers their ability to get the kind of tools and equipment that the hospitals and doctors need. And then to that end, when we speak about the public option, I would really warn that if it sounds too good to be true, then we should question it. And I am not a fan of going towards a public option for our state. The healthcare insurance industry is a huge part of our economy. We have some amazing companies who are here. They have a lot of talent to be able to offer different kinds of insurance products. And I think they would do a better job and lower their costs if the government would not overregulate and put so many mandates on them. So I look forward to helping this amazing industry that Connecticut is a leader in continue to thrive in our state.
Thank you. Thank you very much. Moving on to the topic of housing, and we'll start with Fred for this question. What are you working on or plan to work on to increase access to fair and affordable housing for Greenwich and then for the others, Connecticut residents?
Thank you, Joey. So we'll continue to work with the Greenwich Housing Authority, which is now called Greenwich Communities. They've been doing a great job. When I was in the legislature, I and my colleagues worked closely with them. And just in the last 10 years, and I want to give a shout out to Sam Romeo on this, in the 10 years that Sam's been there, they've spent $27 million in upgrades. They have close to 40 more new units. And I don't remember any new units prior to that for a long time, almost 40 in that time. It's not just workforce and affordable housing, it's quality housing. And they have much more is being planned right now as we speak. So, we'll continue to help them in any way we can. I also put an email out to our state delegation, and we'll hopefully meet with them before the session begins with an idea I have for legislation that would help us a little bit with the attaining that 10% affordable housing goal.
Thank you. Harry.
Yes, I'll continue where we left off in some sense that, I agree so much with Steve and Kimberly on the issues we discussed a moment ago about allowing free trade. We are free trade people and free trade of prescription drugs from Canada. And so the reason I bring it up right now, and similarly supporting a more robust, regulatory framework. And the reason I bring it up is because this tells you how the Greenwich delegation, irrespective of party, between Steve, myself, Kimberly, we are really focused on getting strong ideas, debating them and bringing them forward together, right? And this is unlike people say there's a lot of discord and during elections we do that, all of that stuff, but because we have to, but right now we are focused on solving problems for you, and there's a lot of agreement. We agree, I fully agree on free trade. We fully agree on reducing the certificate for hospitals, certification for hospitals. And now quickly on housing, once again, our Housing Authority doing great. And we need to encourage them to increase the units and do what they do best, which is invest capital. And we need to find new avenues to make sure that there's affordable housing, let the markets work. And then we have our housing authority or communities, Greenwich Communities, which is doing a great job. And we'll continue to support them, and we'll continue to find new solutions as well.
Thank you very much. Steve.
Well, since the Housing Authority covers most of my district, I believe 4 out of the 5 of the public housing projects or the housing projects are in my district. There's clearly a need for moderate income housing in the town. We have to work with the town and with the town government to make sure we achieve the proper level. I think we have to acknowledge that the $27 million that the Housing Authority has obtained has been federal and state funding to provide for renovation of those housing units, and I think that's a great and kudos to the Housing Authority for having engaged in that. I think there's more to be done there. I want to make sure that the entire housing stock there is at the proper level. I've had the chance to tour all the facilities. Some of the facilities are in very great shape. Some need some work. I think providing affordable housing and doing it in the right locations and logically with a long-term development plan from the town is key and essential. So I'm looking forward to sitting down with Fred to have those conversations about how we do that. Looking at the corridors of transportation to make sure that if we are part of the solution, that it's providing people gateways to employment and for them moving up in socioeconomically with opportunity space. So
Thank you.
I'm happy there.
Kimberly.
I think it's very important to have a diverse community where lots of different kinds of people can come here and feel welcome and live here and raise their families. And I think that those kinds of decisions are best made by the communities themselves. It's really about increasing economic opportunity and the availability of prosperity so people can make their own choices. Like government affordable housing has a very oddly limited definition. It's not about affordability. It's actually deed restricted, and it doesn't count anything that's older than 1990. And it's rather arbitrary because we have beautiful buildings that are older than 1990. And just because you are a low-income person doesn't mean you should be limited to a deed restricted building. It's an interesting movement we have in our state right now to force more affordable housing on towns. And I am very much favor of towns opening up and building diverse housing on their own, as opposed to these kinds of top-down mandates coming down from the state. Each of our towns in Connecticut are incredibly unique, from how old they are to the different services that they have. They're very different. And I would not want to see a top-down affordable housing movement from Hartford.
Thank you so much. We're going to start with you, Kimberly, and we're going to go to the topic of mental health. With COVID-19 cases on the rise and the holiday season in full swing, Connecticut medical professionals say it's a critical time to focus on mental health. What are you working on or plan to work on to increase access to mental health services?
I don't have a lot of experience in this area, so I would really ask for anyone who knows more about this to reach out to me and let me know how I can help. My gut feeling is that we don't want to restrict our society anymore. As much as we can safely, we want to try to get back to normal. And I think the sense of isolation and the desperation economically that's been created is very real. And I have spoken to college kids who are so depressed and are feeling isolated. It was a bit shocking for me to hear some of their voices and sense their real hopelessness. So I would, as adults and leaders in the community, I really try to put on a strong, positive face, and I hope we can get back to normal safely as soon as possible.
Absolutely. Harry.
Yes, this is a really big issue, in many ways. Even in normal times, we have to address mental health very strongly because many times it gets passed on as not a real health issue or a secondary health issue. And while a lot has been done in recent years to address that, we still have to make more progress on that. But currently, just as Kimberly said, this is a much bigger issue. And this is what we are trying to really espouse, constrain some of the options which exist to fight the crisis. Because some people will say, well, listen, you know what? We have a major crisis at hand, COVID, but guess what? Let's just put a lockdown. Let's put more restrictions. That will solve the crisis. No, that doesn't solve the crisis because the mental health fallout and other health fallout are very extreme. You can't measure them right now, but we know they're extreme. That option of closing down schools or closing down does not exist. Let's not, think about that possibility to go there, because we will do a lot of harm. So that's where some of the proposals which we have suggested, extensive testing, even ahead of time, once a week testing for everyone, every family, a pool testing. Some schools have been doing it. Some offices have been doing it. Pool testing, which is which is much more affordable. So we have to focus right now to find that right balance so that the mental health issues which are arising out of this crisis, we handle them. We handle them well. They are across the spectrum. The good news is Greenwich school system has done a fabulous job of keeping open, which we should be all very proud of.
Thank
Because
you.
not other school systems have done it. Not other school systems have done it. Stanford hasn't done it. Many of the school systems have been unable to do it.
We are very, very lucky indeed to have Dr. Jones spearheading our schools right now. Steve.
Yeah, I think the mental health issue is best resolved with the increase of accessibility with telemedicine in the short term. That's the easiest solution in the short term to deal with the crisis. In terms of the observations about the COVID crisis and the lockdown, as I mentioned before, the issues on the lockdown, the first issue was availability of intensive care unit beds. During the first go-round, we were able to increase capacity, increase the number, swing units that operated at the hospitals. I said, now what we need to understand is the level of the lockdown is more reflective, not of capacity issue of physical ICU bed units. It's going to be a question of the physical availability of intensive care unit nurses to take care of patients. So I'm a little loath to say we should be changing our lockdown procedures in the short term until we get control of the virus and the pandemic. I think Harry's suggestion on testing is a valid one. We need to improve the testing. On the mental health issue, I think we also have to tie in the local availability of assistance with the state. I've been involved with a couple of people who have particular issues with family members, and I'm trying to help them get access to available help through the state.
Thank you. We're going to move to our littlest town residents right now, to the topic of early care and education. What proposals are you supporting or plan to work on to strengthen early childhood services and education in the state of Connecticut? This may include expanding the Birth to 3 program, ensuring quality or affordable preschool, or other things. We'll start with Harry.
Yeah, we have a really strong set of preschool providers in town. We speak to them often, and we want to encourage them. There is to make sure that every child, every family which wants to send their kid to preschool has the ability to do so, and an affordable preschool. Now, I want to, I know time is limited. I want to, even for them, I've heard one of the issues I heard from them was, can you help us with testing? I spoke to them. We had a long discussion with them on that. And I want to end with saying here that at this point, we do 100,000 tests a day, and most of them have no value. No value. We just water, money down the drain. Why? Because the result comes 5 to 7 days after you basically started your symptoms, sometimes even 10 days. After 10 days after you started the symptoms, the government says, the CDC says, you can actually stop quarantining after 10 days of your first symptoms. So we have to create an environment where we're not, just because we feel good about it, we have an effective system in Connecticut to make these same tests, these 100,000 tests we're doing, effective. And the current system is not working. It's broken. We're not seeing it. It's broken. It's not catching enough people to reduce the spread rate. Spread rates are going up. At the current rate, they will go up further. The 9 small tweaking measures are not going to do anything. If they double another time, both the spread and the mortality another 2 to 4 weeks, we would have existential crisis on our hand for certain demographic groups. We have to act. I think this is right now a moment for us all to galvanize. And there are some very strong answers available from a testing perspective and some other perspective.
Thank you. Indeed. Steve.
Yeah, I think early childhood education is a fundamental need to create the proper level of accessibility of early childhood education. If you look at all the studies and you look at where most of the nonprofits in Greenwich now are focused on closing the achievement gap, and it's an issue of not just you can make it an issue of economic justice, social mobility, et cetera. There are implicit costs in a system that doesn't educate its population. It's a cost in lost economic growth and opportunity. It's a cost in social welfare. It's a cost in healthcare outcomes, et cetera. So advancing the cause of closing the achievement gap and providing for early childhood education, I think is a fundamental that we all need to work on. In Greenwich, I think we have done a fairly good job in attempting to make that accessible. I think that would be an interesting issue to talk, and that's one of the issues probably with Fred we should talk about in terms of the housing authority and the members of the housing authority, and are we making sure that we are providing the proper level of access to early childhood education for the least fortunate members of our Greenwich society, to make sure that the opportunity space is there for their children to become productive members of society.
Thank you. And Kimberly?
I think parents of all incomes have become very involved in their children's education. And to that end, I really hope that being able to make tax-free donations to tuition for low-income families can make a difference for the low-income families in Greenwich for the different opportunities they want for their birth to 3-year-olds.
Thank you. Our final question will be for our first selectman, Fred, regarding commerce in our town. Local businesses, especially restaurants, as we know, are being hit very hard by the pandemic. What is being done to support local restaurants and their workers over the next couple of months?
Thank you, Joey. Just last year, before the pandemic, we were talking about how to enhance the business district down there, how to have a new pedestrian-friendly Greenwich Avenue connected to a new waterfront district. The last piece of that puzzle was outdoor dining and helping the restaurants thrive. And we thought that would be the last piece of the puzzle because of the parking issue, but it turned out to be the first thing we did because of the pandemic. If we and hats off to our Department of Public Works and Planning and Zoning, and everybody else who really got together and helping. We were one of the first towns to get outside with outdoor dining. I meet with them, daily visits, daily contact with our restaurant owners, our merchants. I have very consistent contact with Governor Lamont and David Lehman as DECD Director, Commissioner. We had a public hearing with merchants and restaurant owners Zooming in a few weeks ago. We're going to have another one planned. It's constant ideas going back and forth. We'd like to make a lot of these changes that we have right now in place permanent, but also to get us through this winter. And we have a rough 4 or 5.
You are doing and are planning on doing in this very complex time in our history. Indeed, it's darkness falls very early on. It seems earlier and earlier every day. And we, of course, now are more than ever appreciate those various holidays of lights in our community that are being celebrated. But we are especially thankful for the lights in our community who are our elected leaders who represent us and care for us and our families. And we really, truly appreciate all you do. So on behalf of the Greenwich United Way, I would like to thank Fred Camillo, Harry Aurora, Steve Meskers, Kimberly Fiorello. And I also want to acknowledge our emerita, I guess, Livy Florin, who is, I'm not gonna use the word retired because I have no doubt that you're doing something else, but served for about 2 decades on behalf of our residents. So I wanted to make sure you got recognized as well. Thank you so much. Be safe, everyone, and we'll see you in January.
Thank
Bye-bye.
you so much. Thank you.
Take care. Stay
Bye.
safe.
Thank
and
you.
Happy holidays.